outside, they have not been tested. So at a great cost to us, we have to test them because they are our brothers and sisters, and we also want to do business with them. We want to trade with them, but we cannot allow people from outside Kenya to come without a COVID-19 free certificate, just like we are not allowing Kenyan drivers to leave Kenya without a COVID-free certificate. So the idea is to try and fast-track this as soon as possible. That's why we have got this mobile laboratory that we have taken down to the border. But I would like, when I finish, I'm sure my brother, CS Mohammed, will have something to add on that. In terms of what we want to do and going forward, first, let me just emphasize that we have got a totally coordinated and complete government approach. This is not a Ministry of Health issue. This is the whole government approach, led by, of course, the National Emergency Response Committee on Coronavirus. We have increased our targeted testing. Now, and this is, we should make this very clear. There is no country in the world that is just going around the streets and testing everybody. Everybody goes for targeted testing because you can be very wasteful also. And I explained, I think, in one of my pressers how expensive it is to test. So what we are doing is essentially focusing on areas that we believe, we have reason to test. And that's why you see our figures going up, because we are going to areas that we believe have got it. Otherwise, it is quite possible to test double the figures that we are testing and have a lot less figures in terms of infection rates because of not going to places that you really ought to be looking at. Again, continuing to upscale our testing capacity, our labs. We will continue with travel restrictions, at least in the foreseeable future. And then we have got psychosocial support and reintegration. In the midterm, we are looking at further coordination by NAC. We are talking about capacitating tests. We are making that even wider. We are looking at rethinking our whole issue of quarantine and isolation, both at national and county levels. For instance, if we notice that the people who have tested positive are not sick themselves, we don't have to keep them in hospitals. It is possible for us to reinvent that, to change that, and now start keeping them in isolation facilities and moving somebody to a hospital only if they need hospitalization. So we are looking at that and looking at hotspots and ensuring that in every area where we think there is any chance at all, we are making sure that everybody has got PPEs and so on and so forth. Again, re-emphasizing on psychological and psychosocial support. But in the long term, again, an entire government-wide approach. In fact, NAC at that point becomes only one of the four units that we are using to coordinate entire government effort, for all the way from the command center and our security, all the way to agriculture for food security, all the way to industry, and so on for post-COVID-19 strategies. Again, the issue of restrictions, lifting restrictions, we are looking at that and wondering and looking at how exactly to do that so that we do not open and then experience what a lot of countries have experienced, where they went for these strategies, opened too soon, and then immediately had an upsurge of deaths and infections. We will need a lot of psychological and psychosocial support, as I said, for integration of people, particularly when they come from quarantine facilities, when they come from isolation facilities, when they come from hospitals. And I think we have spoken at length about the issue of stigmatization and ensuring that people you know, who come back to society are not stigmatized, because as I have repeatedly said, anybody, and I mean anybody, can get the virus. And we must have empathy and must support those of us who fall to the disease and to the virus. Therefore, I just want to conclude by once again, I want to thank each and everyone for your support and cooperation. I want to support the Fourth Estate for keeping the fire burning and keeping the people informed, and particularly emphasizing that the war is not won yet. But I am happy with a lot of Kenyans who have continued to support the cause. We are happy about those people who have taken the measures as seriously as they have. And it is because of that, it is because of the cooperation of Kenyans. Even when we notice a lot more people in town, you'll notice that even as they come into town, they are coming with masks. You know, 3 months ago, less than 3 months ago when we met, none of you guys had a mask. Today, everybody has a mask. That's called progress. Asanteni. Yes?
Very good. Thank you very much, Honorable Kagwe, my colleague. I think, first of all, before I comment on what is going on within EAC, I just want to make a brief comment on the observations that I've made on the numbers of infections and the deaths that you have reported. You know, when you see Old Town and when you see places like Kamukunji, you know, the rates of death and the rates of infection seems to be extremely high in those areas. And those of us who are Muslims, especially at a time like now during Ramadan, there's a lot of coming together. There's a lot of coming together for prayers, a lot of coming together during breaking fasts. And we forget, we can easily forget the need for us to do and practice social distancing. And I really want to appeal, numbers don't lie. One of the highest rates of death is being announced in the Old Town in Mombasa. I just want to appeal to our Muslim brothers and sisters during this period. The risk and the intensity of risk gets higher and higher as we approach the festive seasons of Eid and coming together. And I hope the advice that the Ministry of Health and health experts give would be adhered to make sure that we minimize the risks that comes with this